Welcome to It's Worth a Shot this week. This is Kyla Newland, account manager at Mountain Pacific up here in Alaska, and I will be facilitating our call today. We're going to be talking about, we're actually kicking off kind of a mini series within this series to answer questions about the AU and AR module reporting that many of you are going through in your facilities. And we do have a couple of panelists on today that are going to help us kind of kick off some questions. And hopefully folks brought some questions that they would, that maybe we can help answer for you. So we're going to have these every third Wednesday of the month embedded within here, and have this as kind of an open discussion for folks to bring questions and experiences as they kind of move through that reporting process. We can go to the next slide. So as always, if we do have outside presenters, which our panelists are today, we're not necessarily promoting one third party versus another. We're just bringing good information to you to help you in your facilities. We can go to the next slide. So we've got some updates, reminders, upcoming events. This Foundations of Indigenous Harm Reduction looks like a really good webinar, specifically because it focuses on our native populations and across our region. So sign up for that if you're interested. And then we also have actually tomorrow an impact compliance, talking about an expert panel there. Well, 3 expert sessions, I guess, that's going to give you some information about healthcare compliance. So definitely sign up for that one as well. That is a little bit of a longer event. We can go to the next slide. And then quality improvement essentials for infection prevention and stewardship teams. There's a virtual workshop, and that's going to be like a half-day event. So check that out as well. And then social determinants of health, looking at some dementia risk for that webinar, and that's on July 24th. Go to the next slide. So as always, we appreciate your feedback. We do go through the evaluations and take the information you put in there for upcoming topics that might be of interest. So thank you for always filling those out. We have the link in the chat, and you can also feel free to put in chat if you have ideas for upcoming sessions. We can go to the next slide. Oh, our polling question. Thank you so much. I forgot about our polling question. So as it relates to the AU and AR reporting, today we're wondering kind of how far along the process you are if your facility is participating. So if you could choose kind of one of these options as to what your status is, that can kind of give us some good information on where folks are at in that process. And just to clarify as well, currently this is only for hospitals. This is not for long-term care facilities at this time, this reporting requirement, but we anticipate potentially in the future that it might be a requirement in those settings as well. All right, so we can go ahead and close that poll. It looks like some people are not familiar with the AUR reporting, and that may be just because it doesn't apply to your setting. We did do a series prior to this where we went through and explained that whole process, and we do have those recordings available if folks are wondering about that and wanting to get more information. And we can go to the next slide. Thank you, Mary. So we've got a couple panel members here today to help us answer some questions. I'm not sure they were all able to join us, but I do have on the line Tori Dahl from the state of Montana. And I also have Katie Presser. She's a pharmacist up here in Alaska at ANMC. And they will help us kind of go through some questions if folks have additional questions to the ones that we've already kind of prepped up as kind of hot topic items. Do you ladies want to introduce yourselves?
Sure. So I'm Tori Dull. I'm the NHSN HAI epidemiologist of the state of Montana. I've been here for just over 2 years, so if any Montana facilities are on the line, I'm your go-to person for any NHSN questions.
Thank you, Tori.
And I'm Katie Pretzer. I'm the antimicrobial stewardship pharmacist for Alaska Native Tribal Health Consortium up in Anchorage. And we have been submitting data to AUR for about 7 years now, and using the data reports for about 2 years now. So new and old on using this stuff. And I see that Anna also popped on.
Oh, yay. Hi, Anna. We've also got Anna Frick here. She's from the state of Alaska epidemiology, and I'll let you introduce yourself, Anna.
Oh, hey, yeah, what's up? I'm Anna. I'm the HAI epidemiologist and also various other things for the state of Alaska. I've been hanging out at Section of Epi for about 10 years.
Awesome. Thank you. And I don't think Shauna is on, but I will just give a second and ask if she's on at all. All right, let's go to the next slide. So something that came up is there is a proposed rule change for this reporting. And Tori is going to just give us a little bit of information about that to start off.
Thanks. So I just wanted to draw everyone's attention to this proposed rule change from CMS for 2025. This will really impact you if you did claim an exclusion this year because you didn't have the appropriate reporting systems or you send your labs out and get those results back from that facility through a different method. So what they're proposing to do is actually separate the AUR surveillance measure into two measures. So you would have your AU measure and then your AR measure beginning in 2025. So how this would impact you is that if you have a system currently that would be in place and would allow you to submit that AU data, they would require you to do that next year, or your AR data. So we just want to make sure we're encapsulating and getting everybody ready, even if you are exempt at this point in time, to do that for next year. So I know you do need an LIS system for one of them, and then the EMAR and the BCMA for the other. And then there should be on the next slide just why they're doing this, as I explained, is because they saw so many exclusions for this year, or anticipating a lot of exclusions. They just want to capture more data this way. And then you can find more information on this proposed rule change by clicking on that link there at the bottom.
Awesome. Thank you. Tori, any questions?
I was just going to say, I don't know, Tori, if you've gotten this impression as well, but it sure seems to me like we're probably just going to keep seeing this requirement expand to more settings and stuff. So everyone should assume this is coming for them in the future.
Yeah, thank you. I think it'll be good to be proactive in the kind of that anticipation. We can go to the next slide. So these are just a few questions for us to kind of walk through. And I would love everyone to participate either by coming off mute or putting in the chat. And the first question is, what antimicrobial stewardship data do you already have and what do you need? Don't everybody speak at once now. Let me ask you, Katie, are there things that you feel like you need in your experience?
Yeah. So I was about to unmute. So it was timing that you called on me. So the data that I feel really strong about is inpatient data. And what do I need? I really wish I had more emergency room data and outpatient data, and not just having data, but having it in a meaningful way. So it's just many, many, many reports to get that data into a meaningful way. And so inpatient, I feel wonderful. Outpatient, not quite as wonderful.
Yeah, and I think that's a really good point, and that's something that I know the A2SC group in Alaska has kind of tried to switch to really focus on the outpatient setting because we do see so many antibiotics prescribed in that setting. And then, of course, the CDC has their outpatient antimicrobial stewardship guidelines that rolled out a few years ago. But I definitely think there could be an increased focus. Is there anything folks need that they might need assistance with that either Mountain Pacific or one of our folks that's doing this reporting already can help you with? Looks like we have Maria in the chat. She says she can't remember what call she was on, but she thinks NHSN is trying to figure out how to do the data mining themselves using FHIR, which I'm not sure what that is for long-term care.
FHIR, we often call it FHIR. So if you've heard people talk about FHIR, it's sort of like an updated messaging concept, kind of like if you've heard of HL7. FHIR is like a way of messaging that does a better job of being bi-directional than some of the messaging that we use now. So without trying to be too technical about it, the idea is that when we migrate a lot of our technology to using FHIR, the computers will do more of the work for us, and they'll do a better job of like making it so that instead of having the idea is that the computers will do more work for us to help send like useful information, and so that we don't have to, like, if you send us an idea through FHIR, maybe my computer will just go back and get the information that I might need from you without us having to do a whole bunch of additional emailing. It's kind of complicated, but the idea is that it will keep making our lives easier.
Okay. Yeah. Thank you so much, Anna. So I will go ahead and move on to our next question. Who is claiming an exemption? And if you are, why? So maybe no one on the call is claiming an exemption?
I've definitely heard at least one facility claiming an exemption for the resistance module, which I think is likely to be more than one of our smaller hospitals. I think that's usually the sticky wicket for us around here.
Yeah, for sure. And I see someone put in the chat, I am because I was late in the process and don't have the tools. Is there anything that we could do to help you out? Maybe one of our folks that's a little bit further along in the process.
So this is Donalda. I'm at Weston County Health Services.
Hi, Donalda.
Hello. And Christine has been helping me with this. I only started this in March and actually came upon it accidentally. The previous infection person wasn't doing it and really didn't think she had to, I guess. She thought someone else was doing it in the facility. So I'm kind of behind, and I'm gonna file an exception. and then hopefully get the tools I need to start doing it after August.
Okay, great. Thank you for speaking up. Anybody else have any discussion related to exemptions?
Just to echo what Anna said, if people are wondering if they are eligible for an exemption, the NHSN site has the most detailed, sorry, not the NHSN site, the CMS site has the most detailed information on what qualifies you for an exemption. But the most common one that we have seen in the calls is that your lab does send out values and you don't have a way to send that to NHSN through your EHR. So if you have send out labs, that's probably most likely where you are going to get that exemption piece from.
Thanks, Katie. And then our third question, which vendor are you using? And this was just kind of, this question came as kind of a way to potentially connect people that are using the same vendor and see if they could kind of help each other out or share experiences. Okay, I see a comment in the chat at Fairbanks Memorial. They're using Oracle, which is Cerner, as a vendor. We have data, but it has not yet been validated. Not entirely sure about the validation process. Vendor IT has not been entirely clear about who does what in the validation process. Can anybody on the call speak to that from experience?
Yeah, so in the validation process, NHSN is going to request files. So you'll have to log into NHSN and say you're opting into all the stuff for the AUR, and then they will send you an email requesting test files. And so that will be the validation process. And they have a few steps that will walk you through there to make sure that it's sending the correct data. And that's part of those test files. Usually it will be on the person who's submitting the data. It will be on their side to send those test files, but you probably most likely will have to work with your IT EHR person to make sure that those are communicating correctly. Does that make sense?
When we're validating messages, there's like two things that we're trying to do, right? One is we're trying to make sure that the messages are like correct as a computer thing, like it's shaped the right way so that the computers can read them and all of the data that's in the message goes to all the right places. And then we're also trying to make sure, like from a human standpoint, that the data like worked out right and it says the right thing. So there's sort of two parts of validation and they might not be done by the same person.
All right, it looks like you answered that question. So thank you, Katie and Anna. Anybody else have questions, comments about vendors?
And I can say, I think I said it on a previous call, but we're using Theradoc as our vendor. That was what worked for us many, many years ago, and we have kept using that. So I know a little bit more about the Theradoc part versus directly from the EHR. And then I know Shauna's using it directly from Epic. So Shauna has more insight on directly from Epic EHR.
Okay, yeah, and if anybody needs, wants to connect with Shauna, I can definitely connect you with her. She's been pretty far through the process, and she's going to be covering multiple facilities in the state of Alaska as well for their reporting. And she was not able to be here with us today. So are there other questions, just general questions related to the AUR reporting that folks would like to ask? Okay, well, hearing none, this open office hours will be a recurring opportunity, and we are hosting these the third Wednesday of every month at the same time. So if things do come up and you want to bring those forward to us, we are happy to help connect you with somebody that can answer it if we can't answer it on the call, or help you network with folks with your peers that might be able to have insights depending on the level of experience in this reporting process. So just a couple of resources, FAQs from the CDC website here for you folks. And please do fill out the evaluation and let us know if this session is helpful. This is something we hope to continue doing, but if we're not getting a lot of questions, we may just kind of serve as the networking person to connect folks individually and do more of like a direct technical assistance type outreach for assistance with the AUR reporting. And our next week's topic is going to be skin cancer awareness. And we will have somebody, an outside presenter, presenting to us on skin cancer. So thank you, everybody, and enjoy the rest of your day and the rest of your summer. Thank you for your time.
Bye.
Bye.
Thank you.